I'm Jacqueline. I'm going to be performing a musculoskeletal assessment on a patient today. First, I'm going to close the door to ensure my patient's privacy. I'm going to apply hand sanitizer for about 30 seconds or until my hands are fully dry. I'm going to put some gloves on. Could you tell me your full name and your birthday for me, please?
Audrey Hill, 7/24/1969.
I'm going to be performing a musculoskeletal assessment on you today. First, I'm going to start by inspecting your hands for any abrasions or scuffs or bruises. Okay. No abnormal marks over here. Now I'm going to palpate to feel anything abnormal. This side I'm going to palpate as well. Do you have any stiffness or soreness in your hands?
No.
Okay. Perfect. Now I'm going to have you move your hands up and down and around. Perfect. I'm going to have you squeeze my hands. I'm going to test your strength. Okay. Perfect. Now we're going to move up to your elbows. Going to inspect for any abnormal scuffs or marks. There's no bruises. Looks good. Do you have a scar here? I'm going to palpate. Everything's normal. No lumps. Okay, now I'm going to test your range of motion, so if you could pull your arms out and in, out, perfect. I'm going to test your strength, so if you could just put force against my hands, perfect, good. Okay, now we're going to move up to your shoulders. For privacy, I'm just going to pull your shirt down, is that okay? Just a little bit. Okay, everything looks normal. I'm going to just palpate. Do you have any soreness or stiffness in your shoulders?
No.
It's okay if I pull down? Looks good. Palpate. Okay, now we're going to do your range of motion, so if you could just circle. Perfect, now circling back. Okay. Okay, so now we're going to test your shoulder strength, so if you could place your hands against mine and push. Okay, great. Now we're going to do your jaw, so go ahead and pull your mask down for me. Okay. First thing I'm going to inspect. Looks good. No abnormal marks or bruises. Palpate. Okay. Now if you could open your mouth all the way and close it. Okay. And go ahead and clench down for me. Okay. Perfect. Okay. Go ahead and put your head forward for me. Check your cervical spine right here. First, I'm going to palpate to see if everything feels good, feels straight. There's no abnormal bruises or marks. Okay, so for range of motion, I'm going to have you put your head all the way down to your chest and all the way back up. Okay, and for your strength, I'm going to have you put force against my hand. Perfect. All right. Now I'm going to go down the rest of your spine. Go ahead and lean forward, palpate. No lumps, everything feels good. Okay, I'm going to raise your shirt up a little bit, okay?
Okay.
Just to inspect, see no abnormal marks. Okay, go ahead and stand up for me. I'm going to have you bend forward, back backward. And then to test your strength, I'm going to have you try to bend forward against my hips. Perfect. Okay. All right, now we're going to do your hips. I'm going to palpate them. I'm going to raise your shirt up just a little bit. Everything looks good. There's no abnormal marks or bruises. Do you have any pain or stiffness?
No.
Okay. Okay. That's good. This side. Okay. Looks good. Okay, so for range of motion, I'm going to have you place your hands on your hips, go to the side, go to this side. For strength, I'm going to have you keep your hands on your hips and place all your weight on one side. And twist. And then one side and twist. Okay, perfect. Go ahead and have a seat. We're going to do your legs now. Pull your pant legs up as far as I can. Okay, I'm going to palpate first. Okay, everything feels good. Do you have any soreness down here?
No.
Okay. Okay. Inspect for any abnormal abrasions or bruises. Everything looks good. Okay. Go ahead and take your shoes off for me, please. Okay. Okay, I'm going to test the strength of your legs by try to kick me, okay? Perfect. Okay, now kick your leg all the way up and then all the way down, all the way up, all the way down. Okay, perfect. We're going to move down to your feet. Take your sock off. I'm going to palpate for anything abnormal. Everything feels good. Any soreness in your feet? Look good. There's no abnormal scuffs or marks. This one feels good as well. There's no abnormal lumps. Everything looks good. No abnormal bruises or scuffs. Okay, we are all done. Go ahead and put your shoes and socks back on.
Thank you.
I'm going to perform some hand hygiene and we are all done.